The nursing program, missions, philosophies, handbooks, and miscellaneous. You are about to embark on a life-changing experience. The nursing program is going to bring you to new maturity levels, skill sets, and thinking abilities. You begin this process by being able to make critical, on your feet decisions. It's important to understand that you have chosen a professional career in which you will one day hold the lives of your patients in your hands. To accomplish this, the KCKCC nursing program will not only teach you nursing skills and knowledge, but you will also be learning professional behaviors required by nurses, and you will be held accountable for your actions or lack of action. Rules for KCKCC nursing program have been developed for several reasons: to protect you from injury and harm, to protect the people that you come in contact with as a student, to prepare you for a professional career as a nurse, to support the KCKCC nursing philosophy and mission. So, how did the rules and regulations and policies come to be written? They were discussed and written by the Kansas City, Kansas Community College, by the Kansas State Board of Nursing, by the clinical facilities, and past student experiences. These are some examples of consequences of not following the rules, regulations, and policies at KCKCC. You may receive a 0 grade, especially if you don't make prior arrangements for missed assignments or examinations, or not calling for clinical tardiness or absences. You may receive dismissal from the program and/or the college, especially for academic dishonesty, which can include cheating and plagiarism. You may be dismissed from the clinical site for the clinical day. The school could lose contact with the clinical facility. This could be caused from unprofessional behavior or HIPAA violations. These are examples of not following those rules. So hopefully none of us have to experience them. So if you have a grievance or a complaint, you have to follow the chain of command for resolution. If you don't follow this chain of command, problem resolution is going to be delayed, or potentially it will not be resolved. So we start off with the instructor. If you don't get satisfaction, then you go, excuse me, then you go to the director of nursing, which is Dr. McFadden. If you don't get adequate resolution from Dr. McFadden, then you go on to the Dean of Health Professions and Public Safety, which is Dr. Bohm. And if you don't get adequate resolution there, you would move on to the Vice President of Academic Affairs, Mr. Jerry Pope. So make sure that you follow the chain of command, because if you don't, then you will be sent back to the beginning and have to start all over. And this is where the delay comes in. Content for this program is based on the Kansas State Board of Nursing core curriculum for the PN program and concept-based curriculum for the ADN program. The handbooks that we will be using, or that are referred to, is the KCKCC Campus Handbook, the Student Nursing Handbook. You're going to be held accountable for the information that's contained within these handbooks. You're also going to be required to sign an acknowledgement every semester indicating that you are familiar with the Student Nursing Handbook. So Yeah, it's kind of long, but you do need to read it. Each semester, the class will be asked to elect student representatives. In the PN program, representatives will include a class president, a vice president, and a historian who's going to be responsible for collecting class pictures and preparing your class pinning presentation. But with all programs, these representatives will attend one nursing faculty meeting every month. The class will provide student representatives with their concerns. So if there are some concerns regarding how the class is being taught, uh, you have concerns with some of the material, this is not a venting situation per se, but it is a place where we can take material to the faculty to try and reach some type of resolution. So you attend one nursing faculty meeting every month. The class will provide the student reps with concerns and will relay student information to the nursing faculty and staff. The nursing faculty and staff are going to provide that information that the reps will then bring back to the class. These representatives should have excellent communication skills and understand that being a class representative could actually be placed on your resume as leadership experience. So if you're interested in being a representative for your class, I recommend that you start campaigning now. Success is going to require student motivation, student hard work, and it's going to require the students to be accountable for their own successes or failures. It's studying and completing assignments on time, asking clarification on muddy points, putting forth the effort to understand a concept. It's not, well, the instructor didn't tell us that. It could have been in the presentations, the discussions, the assignments, the readings, and or the student success sessions. Maybe you just missed it. Well, that's not the way we do it at work, or that's the way we do it at work. Well, you're not going to be tested on the way you do things at work. You will be tested on the information that is presented during your program. Or that's not what the clinical instructor said. I'm sorry, there are a multitude of ways of doing different tasks. However, we at KCKCC are teaching you what we refer to as the textbook method, meaning that this is the material that you will be tested on. You will not be tested on what someone else tells you or what you've seen at a different facility or what you've seen or done during your work experiences. Your instructors are going to give you the tools for success, but it's ultimately up to each one of you individually as to your success. The KCKCC mission and purpose is to inspire individuals and enrich our community one student at a time. The nursing program mission and purpose is to provide excellence in nursing education, inspiring diverse graduates to demonstrate competence in clinical judgment, resulting in quality, evidence-based, client-centered care to enrich the health of our community, one student at a time. The nursing program philosophy is the faculty believes nursing is a specialized profession utilizing art and science to provide evidence-based care that addresses the constantly evolving needs of diverse individuals and populations. The nurse uses clinical judgment to integrate objective data with subjective experiences of a client's biological, physical, and behavioral needs to plan and guide care. Nurses provide quality care with members of the interprofessional team to achieve safe and effective client outcomes. Nursing practice is humanitarian. It's caring. And we have a knowledge base based on nursing science, biological and physical sciences, social and behavioral sciences, communication, and information technology. The graduate of the KCKCC Practical Nursing Program is going to utilize the critical judgment model to facilitate clinical decision making in assisting diverse populations to function at their optimal level of wellness across the lifespan. They will utilize the clinical judgment model, the nursing process, and a knowledge base from nursing and the biophysical sciences to promote and facilitate informed decision making and achieve positive outcomes and support self-care activities in structured inpatient and outpatient settings. They will maintain effective communication with clients, significant others, and interdisciplinary team members in planning and delivery of healthcare. They will acknowledge the necessity for continued learning as a part of personal and professional growth. And they will perform within the discipline of nursing as a caring, ethical, responsible, and accountable member of the healthcare team. Following the program, then you will be eligible to sit for your NCLEX exam and receive licensure when you've successfully passed that exam. You will be able to become employed as a nurse, and your employers will be satisfied with the type of nurse that you will be after completing this program. And we'll have program satisfaction from your NCLEX pass rates. And hopefully you will move into an ADN and BSN nursing program if you are a PN, if you are ADN, moving into that BSN, and hopefully even moving further towards maybe a master's degree or doctorate. So instructor availability is going to be a little different for every instructor. Most of us do encourage appointments. It helps with our scheduling. Texting or phoning will be per instructor. Our hours of availability and contact information will be located in the syllabus addendum or outside our offices. To pass the program, the first 8 weeks of the first semester of the PN program, you have to have at least a 74% exam average. If you achieve that, then we look at your comprehensive score, or everything that's involved within the course has to be at least 76%. And those courses would be foundations in pharmacology. All other courses in the PN program, you have to achieve at least a 76% exam average before we look at your coursework average. So once you achieve that 76% average, then we look at your coursework, and it has to be at least 76%. With the ADN program, we're talking about an exam average or comprehensive score of at least 78%, and this is all the way through the program. If you're successful in a didactic course, you also have to be successful in the associated clinical course or lab. So if you're unsuccessful in the clinical course or lab, then you're unsuccessful in the didactic course. So they go hand in hand. It is, once again, necessary for you to be familiar with the student handbook and its contents.